Hello, I'm Bjarke Abrahamsen and I work at Department of Research and Development at the Danish College of Pharmacy Practice. I'll present the study Mapping of Danish Pharmacy Technicians Students' Third-Year Projects in a Year with the COVID-19 Pandemic, a study we published in Pharmacy. In Denmark, pharmacy technicians represent the largest group of the pharmacy workforce. The main tasks cover counseling of patients using prescription medicine, over-the-counter medicine, and non-medical products. All pharmacy technicians in Denmark are educated here at the Danish College of Pharmacy Practice. The 180 ECTS points 3-year education program is divided between academic teaching and practical training at community pharmacies. The aim of the study we wanted to map the themes of pharmacy technician students' third-year projects, and we wanted to provide an overview of the challenges experienced due to the COVID-19 pandemic. Here you get an overview of the methods for mapping of students' third-year projects. Titles were extracted from their reports and distributed to 5 researchers. A list of themes was generated through consensus decision-making by all 5 researchers and presented and discussed with 2 project supervisors. Lastly, all projects were allocated to one of the final themes. Mapping of challenges and limitations for students' third-year projects due to the COVID-19 pandemic were discussed at an analytical workshop. Statements from supervisors were registered and summarized by the researchers, and lastly, the project supervisors validated the summary of the challenges and limitations. On this slide, you get an overview of the themes for pharmacy students' third-year projects. A total of 178 projects were submitted and 140 students gave consent for the projects to be included. A total of 8 themes was generated. The themes were advanced pharmacy services, digital patient support, organization and collaboration, handling of medicine, automated dose dispensing, medication counseling in community pharmacy, hospital pharmacy, and others. In the paper, you can see a more detailed description of each theme. On this slide, I present the results from challenges and limitations experienced due to the COVID-19 pandemic. So, for generating and collecting data, students' possibility to generate and collect data became limited, and access to patients, hospital pharmacy, and pharmacy colleagues from associated pharmacy branches and external collaborators got restricted. This also meant that for the methods, observations, teaching, and interviews were almost impossible and replaced by surveys and online interviews. This had a huge effect on the need for flexibility, because students showed frustration and declining enthusiasm, but they got forced to reflect on their choices, to use supervision in a more creative way, find new ways to generate data, and consider how the changes affected the quality of the project. Students, community, and hospital pharmacists and supervisors showed great flexibility to accommodate for the numerous changes in projects. In conclusion, the mapping of students' third-year projects resembled themes registered from previous years, covering many aspects of pharmacy practice. Also, the completion of projects was possible in a year with COVID-19 challenges, because supervisors, hospital pharmacists, community pharmacists, and in particular the pharmacy technician students themselves demonstrated great flexibility and creativity in doing their third-year projects. On this final slide, you find any relevant references used for this presentation. Thank you.